there's an organization that Liberatum will take us to. And I want you to tell us what is that organization and how will this organization help?
So I, thankfully with my great colleague and friend, Dr. Crystal Lee, she has a doctor in public health. I think we've known each other for such a long time. She put this organization together called United Natives. And basically it is a nonprofit organization where we try to bring awareness about Native American issues, not just the Navajo tribe, Dene tribe, but all tribes. And I had asked if I could be a partner in that because I knew possibly that I could do more aside from being a doctor. As a frontline worker, that for a while there we were lacking so much PPE, right, on the reservation. Supply and demand were extreme highs for medical grade PPE. You know, we're competing against other major facilities in New York, now Texas, now all of Arizona, which are huge states, right? And then these are essential items that we need to do my job so that I stay protected, and not just me, but also protect the patient. You know, I see so many COVID patients when I'm doing car triage and urgent care on the hospital floors that I have to protect them from me and then they to me. You know, and eventually, you know, I don't want to take that chance for myself. I've had colleagues who've gotten sick. You know, we have other physicians that have died from COVID, very young. We had a physician who was 30 years old, and she's younger than I am, and she was intubated. She's fully healthy. Do I want to take that chance? No, I don't. So the organization initially is for frontline care workers on the reservation where I gather donations, medical grade PPE and community-based PPE, so we can get it into the community as well. As a doctor, what do I do to stop the virus as best as I can for the community, for the public health awareness? So gathering monetary donations or collecting sanitizers, hand sanitizers, because we don't have running water. And so we really need that. Cloth masks. Also face shields for people who are nursing homes, children's homes, shelters, people that more high need, because they're trying to care for the community and they're getting exposed to. And we've already done amazing things with nursing care centers on the reservation, where we've given them washable isolation gowns, face masks, goggles, things like that. So that's primary for the community. And then for frontline workers, giving N95s, gowns, face shields as well, to frontline workers like paramedics, EMTs, nurses, docs. So that's just to keep us safe, because we are very limited in our staff on the reservation in general. In all rural areas across the United States, it's like that. So, with the organization, that's what we're doing.
The organization is called United Natives, and
United Natives.
Organization, we can send money, we can send also goods and foods and water and equipment, right?
Yes, absolutely. We never are going to turn away any donation because it's going to be used, right? So water, of course, we've gotten canned foods, dry goods that we can obtain and then ship out. You know, we are United Natives. You know, I have patients for Apache and Hopi, and we're going to do like a big shipment tomorrow to the Hopi Nation, because we are united as one, doing these things. And so we want to reach as far and as wide as possible to get these things out there on the community, because it's a public health issue, right? I can only do so much when I'm in the room with the patient, but I can help prevent spread with hand sanitizers and water and cloth masks. You know, that's the purpose of trying to stop the virus wherever it may be.